but...
Hi, this is Christine. Hi,
Christine. Hey, sorry, this is Priscilla Clark with Myers and Stockler.
Hi, Priscilla. How are you?
I'm doing good. How are you doing?
I'm doing just fine. I'm just kind of getting everything logged in. It looks like Caroline is also on the call. I'm not sure if she's dialed in yet, though.
Okay, perfect. And when you hand over the controls to me, it's going to say Alicia Jones. My computer's automatically logging me in through my boss's account, so.
Okay.
Hey, good morning, everybody. It's Caroline.
Hi, Caroline.
Morning, folks.
Good morning.
Say, what is the? It's not allowing me to sign in. What's the password? Is webinar 2020?
Let's see here. Webinar with a capital W.
Right.
Then 2020 is the password.
And then any name that I choose to put in there?
Yes, it's always nice if
Okay.
you will let us know who you are, Terry, although it does sound like you, but maybe not. I think Connie's going to come down to my office as well. I do see Alicia Jones in my menu, so that way I can easily pass the ball over.
Thanks, Christine. Appreciate it.
Sure, you're very welcome. I think the last time I checked our Eventbrite, we had about 25 folks registered for today, so, 32. Increases all the time. So we'll give folks some time to join.
Hi, everybody. This is Alicia. Just letting you guys know I'm here, too. I'm in the room with Priscilla.
Hi. Nice to meet you. Oh, yes. Hi, Connie. Come on in. We're just getting set up here.
I brought my computer, but I don't think we need me hooked in because I'm not going to be presenting.
Correct. On the line is Carolyn and Terry and Alicia and Priscilla.
Priscilla. Hi, everybody. It's Connie. I finally got out of the last meeting.
Hey, Connie.
Hey, Connie.
Alicia, Priscilla, I just emailed you. You should have in your inbox the authentication information you need to get into EPIP now.
Perfect. Thank you so much, Terry. We really appreciate you doing that.
Yeah. Thanks to Ray Ortega. He's the one who chased it down. So.
That? Yep. You want it?
Oh, I have it. I have it up right here. So, good morning, everyone. Oh, I'll let Connie start. I'm sorry.
So what I just wanted to kind of go over the logistics. It's not any different than we did last time. About 5 minutes before, Christine will announce and say we're going to wait a few minutes. At noontime, we're going to give them another 4 minutes. And then she will go through, the few logistics. It'll be recorded and all those kinds of things, how to pass the ball and everything. And then I will introduce Priscilla. And I will use, Priscilla, the same thing that I did last time. I'll introduce you as Senior Accountant with Myers & Stouffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs. And at the end of that Priscilla's presentation, I'll say thank you, and then we'll see what Christine has in the chat box. we'll read those to you and continue on talking through the end of that. And if you need to go through the questions and answers, if we don't have enough email or chat box, I should say, questions, then we'll go to the Q&A listing and we'll go from there. Any questions or anything I've missed?
Sounds very organized.
Sounds good to me as well.
Okay. So, all right. So we're going to pass the ball. I'm just going to see if I can pass the ball to you so you're ready to go, and then I can introduce to you because I don't have anything on my side. So, Alicia, it's your computer that we're going to make be the host to start, correct?
Correct.
Okay, so I'm going to change the role to be presenter, and hopefully that will allow you to share your screen.
So it's Priscilla is actually going to do the presentation. Is that true?
Yes, that is correct.
Okay, because I was going to say, whoa, I don't want to introduce Priscilla if it's Alicia doing that.
No, it came up as
confusing.
Alicia.
Priscilla has to use my credentials to log on to WebEx, so it shows up with my name, but she's actually doing the presentation.
Yes.
Okay, got it.
And I can go ahead and put the main slide up so that everyone can see it once they get on.
Okay. Cool. I'm just going to can you see that okay,
Yes,
Connie?
I can.
Okay, great. I can see your screen, so that is fantastic.
Can you see the slide up, the main slide up?
I can. Electronic clinical quality measures for meaningful use.
Perfect.
So, and it looks like we're having folks dialing in now, so I will start to kind of mute lines here, and then as we need to unmute them, other speakers, I can easily do that. So, Carolyn, you'll end up being muted for this time period, but I can unmute you later. And Alicia, or Priscilla, I'm going to leave yours open. I see there's no microphone, so they're maybe using a headset.
Okay. And you can't.
No. Good morning, everyone. This is Christine at Health Current. We are about 5 minutes before the noon hour, and we'll be getting started with the Access Clinical Quality Measures CQM webinar sponsored by Health Current shortly. We have quite a few folks that are joining this afternoon, so we'll give everybody to get a chance to log in before we turn the presentation over to Priscilla Clark with Myers and Stouffer. Just a reminder that all lines are muted. Today's webinar will be recorded, and if you do have questions throughout today's presentation, to use the chat feature so we can go ahead and get those answered by our presenters. Thanks very much, folks. Hang tight, and we will start the presentation in just a few minutes. Good afternoon, everyone. This is Christine at Health Current. We just have a few more minutes to the top of the hour. Just a reminder, today's webinar is being recorded and will be posted to the Health Current and Access websites. Just a reminder to use the chat box, and if you can include your name and your organization, just a reminder, no PHI, patient health information, when asking questions. All lines are muted, and we will begin our presentation in just a few minutes. Thanks again for joining us, and hang tight. Good afternoon, everyone. This is Christine at Health Current. Thank you for your patience today, and thank you for joining us for the Access Clinical Quality Measures CQMS webinar sponsored by Health Current. We are going to get our webinar underway today. Just a reminder, today's session is being recorded and will be posted to the Health Current and Access websites. Please use the chat box and include your name and practice organization. If you are posing questions, just a friendly reminder to do not post any PHI, patient health information. Today's webinar is presented by Priscilla Clark with Stofers and Myers, and I will turn this over to Connie Ide, our program manager, for continuing introductions.
Thanks, Christine. I do have the dubious honor of introducing Priscilla. Priscilla Clark, as Senior Account Manager with Myers & Stouffer, a certified public accounting firm that specializes in federal and state Medicare and Medicaid programs, is our Access Clinical Quality Measures, CQMS, webinar presenter today. Priscilla, Christine will now enable you to share your screen so we can begin your presentation. Thank you.
And I think everyone should be able to see Priscilla's screen. Priscilla, are you with us? I can see your screen, Priscilla, but I'm not sure that I can hear you, so. Let me try and unmute the lines and see if you don't come through now. Priscilla, can you hear us?
Yes, I can. Can you hear me now?
I can now, thank you.
Okay, perfect. Sorry about that. Okay, perfect. Thank you so much, Connie and Christine. As Connie has already introduced, we will be discussing today's topic of electronic clinical quality measures for meaningful use. And I'm Priscilla Clark with Myers & Stouffer. And so the first question that we're going to cover is just the basics of what is electronic clinical quality measure. An electronic clinical quality measure, which we will be calling eCQMs throughout this entire webinar, it uses data electronically extracted from the Certified Electronic Health Records Technology, in other words, the Cert, and it collects the health information technology systems to measure the quality of health care provided. The Centers for Medicare and Medicaid Services, CMS, uses the eCQMs in a variety of quality reporting and value-based purchasing programs. Hospitals, professionals, and clinicians use eCQMs to provide feedback on their care systems and to help them identify opportunities for clinical quality improvement. eCQMs are also used in reporting to CMS, the Joint Commission, and commercial insurance payers in programs that reimburse providers based on quality reporting. So as you can see, these eCQMs are very important in a variety of different programs and organizations. Some of the reporting similarities between promoting interoperability and other programs, CMS has updated eCQMs for potential inclusion in the following programs for the providers, such as the Quality Payment Program, which covers the Advanced Alternative Payment Models and the Merit-Based Incentive Payment System. It also includes the Advanced APM, the Comprehensive Primary Care Plus, as well as the Medicaid Promoting Interoperability PI program. eCQMs support achievement of healthcare goals, and so there's three main goals, and underneath them there are certain things that help meet those goals. The first is better health. It helps promote evidence-based clinical processes. It helps measure preventing and treating priority conditions. It also improves outcomes by identifying deficiencies in safety and accessibility. Under the better healthcare goal, it reduces provider burden, such as administrative time, by streamlining the measurements. It improves functional assessment of chronic conditions, and it facilitates care coordination across settings. The third goal is the lower cost. It reduces preventable hospital readmissions. It decreases medication errors and promotes appropriate usage of diagnostic testing and screening. Some CMS guidance. CMS is moving from having each EP simply report eCQMs to having each EP's performance assessed based on the reported eCQMs. And so they're trying to help provide better care through that. CMS is urging Medicaid providers to choose measures aligned with their practice. The agency advises reporting on measures containing numerators and denominators before reporting measures containing zeros. So the definition of eCQM for the PI program, the requirements specifically for program year 2019 are what we will be discussing in today's webinar. An EP has to attest to 6 out of 50 available eCQMs. One of those 6 reported eCQMs must be an outcome measure, and there are 6 outcome measures, which we will discuss in more detail in a little bit. If there are no outcome measures, and they're not relevant to the EP must report on at least one high priority measure. And there are 27 high priority measures, which we will identify in a few minutes. And as established in the physician fee schedule rule, high priority measures for the PI program are determined via 3 methods. The high priority measures that are identified under the MIPS program, there's also measures included in adult and child core sets that are considered part of those CQM high priority measures. And then also CMS has said that any additional measures selected by individual states. However, for Arizona purposes, Arizona has not selected any additional high priority eCQMs. So providers who are attesting need to be aware of that and make sure they select from the 27 high priority measures that CMS has identified. To continue the program year 2019 eCQM requirements, if there's no high priority measures are relevant to the EP scope of practice, they may report on any 6 relevant measures. EPs must report on the most recent version of each eCQM available in the Cert, so it depends on what version the Cert has available for each provider. The eCQM reporting period will be 90 days for EPs attesting to their first year of MU. However, the eCQM reporting period will only be 365 days for returning EPs. So providers do need to be aware of the different eCQM reporting periods and to make sure that they are attesting to the correct time. So what's the distinction between CQM versus eCQM? So CQMs can be calculated outside of the Cert via, for example, a chart abstraction, but eCQMs are calculated electronically by the Cert. The phrase eCQM does not indicate the data was transmitted electronically, but essentially that the eCQMs were calculated electronically by the Cert and it is still transmitted to the agency manually via attestation in EPIP. So you still have to pull that report out of the Cert, but the Cert needs to calculate it inside their system electronically. All CQMs reported for purposes of the PI program must be calculated by the Cert. That is, you need to make sure that the report that you are pulling has the CQMs calculated by the Cert. Therefore, for the terms eCQM and CQM are used interchangeably for the PI program in many CMS resources. So even if you see just CQM and you don't see that E for electronic beforehand, for all these CMS documents regarding the PI program, keep in mind that it's still requiring that the Cert calculates it electronically. So there also are adult and child core measure sets for CQMs. CMS identified 2 recommended core sets of eCQMs, one for adults and one for children. We encourage the providers to report from the recommended core set to the extent those eCQMs are applicable to the provider's scope of practice and patient population. CMS selected the recommended core set of eCQMs for providers based on analysis of several factors, which we're going to go over quickly. Conditions that contribute to morbidity and mortality of the most Medicare and Medicaid beneficiaries. Also, the ones that represent national public health priorities, the ones that are common to health disparities, that are disproportionately drive healthcare costs and could improve with better quality measurement. Measures that enable CMS, states, and the provider community to measure quality of care in new dimensions with a stronger focus on parsimonious measurements. And then also measures that include patient and or caregiver engagement. And so we're going to open up these 2 links at the bottom of this slide just to show you all the list of adult core eCQMs and the child core eCQMs. And so once y'all receive these slides in the next 3 to 5 business days when they're uploaded to the Access and Healthcare Current website, when you pull up that PowerPoint, those links are going to take you straight to this link that shows the list of CQMs for the adult healthcare quality measures. And so you can see the NQF numbers, the measure names, and kind of just the whole list of the CQMs that are CMS has flagged as extremely important to the health population and helping them. And we'll also open up the child core eCQMs. And you'll be able to see the ones that are more specific to children and those CQMs that CMS is recommending providers attest to help give better health care to your patients. Okay. So then next are the outcome measures. So remember, as we discussed earlier, providers have to attest to 6 CQMs. However, one of them needs to be an outcome measure. And so here's a list of 6 outcome measures that have been identified, and there's a link at the bottom of this slide as well that takes you to another link that identifies which ones are the outcome measures underneath this column measure type. And this lists all the CQMs for program year 2019. So if you want to see a comprehensive list of the CQMs that a provider can attest to, you can come to this link. And under measure type is going to be, shows intermediate outcome, and if we keep going down, there's another outcome as well. And so it identifies which CQMs are those outcome measures. However, this slide does identify in the PowerPoint the 6 outcome measures that a provider should attest to. However, as we stated earlier, if no outcome measures are relevant to the EP scope of practice, the EP must report on at least one high priority measure. Now, these 27 high priority measures are listed on this slide and the following 2 slides, so it's easy access for y'all to see which ones are the high priority measures. And there we go, there's a lot more. And so at the bottom of this slide, the end of the 27 measures being listed, that link for high priority measures is going to take you straight back to the link we just showed you that identified the high priority measures. And so it's very detailed. So under this column, high priority, it has an X/A. And then under here as an A, you may be wondering what those stand for. The A stands for the adult core CQMs that we discussed. And there's also the acronym for C, which stands for the child care CQMs. And then when there's only just an X next to the CQM, it means that it is just a high priority measure. It's not an adult core CQM, and it's not a child core CQM. Now, if you get confused later down the road and you're wondering which one stands for which, at the bottom of this PDF, it does identify what the X stands for over here on the left-hand side, and X is for high priority measures under MIT, and then A is the high priority measure under Medicaid PI program as a measure on the adult core set. So that will remind you of what each one stands for to help you. Okay. So measure calculation. For purposes of the PI program, the eCQMs are calculated from the total patient population or subset of the patient population based on age, condition, and other factors. Data is not limited by the payer. So just some examples of the eCQMs for EPs. We're just going to go through a few of them. So for example, there's the CQM 125, which is breast cancer screening. And so it checks the percentage of women 50 to 74 years of age who had a mammogram to screen for breast cancer. There's also a link, the measure specifications, and so you can click on that link and it will take you to the details listed on the eCQI Resource Center, and it shows you what calculates for the numerator and what calculates for the denominator. And in a few minutes, at the end of this presentation, I'm going to show you how you can check for all of these different CQMs and their specifications if need be. So the second example of eCQMs is the diabetes hemoglobin A1C core control, which is CQM 122, version 7. And this is also an outcome and high priority measure. and it checks the percentage of patients 18 to 75 years of age with diabetes who had hemoglobin A1C greater than 9% during the measurement period. And in that link, the measure specifications also will take you to the page that shows the details behind the CQM, such as what goes into the numerator, what goes into the denominator, among other things. The last example we're going to go over is the antidepressant medication management, which is CQM 128, and this is a high priority measure. So it discusses the percentage of patients 18 years of age and older who were treated with antidepressant medication, had a diagnosis of major depression, and who remained on an antidepressant medication treatment. And two rates are reported, so there's two parts to this. There's the first one, which checks the percentage of patients who remained on an antidepressant medication for at least 84 days, and then the second part is the percentage of patients who remained on an antidepressant medication for at least 180 days. And we're going to bring up the measure specification sheet because I want to show you how there's a numerator and denominator for each part, because there's two parts to this CQM. And so if you scroll down, you see all the details of it, the initial population, you see the denominator and the numerators, and then there's also just some guidance down below for providers. And it has a bunch of different notes and everything that you can see the logic behind how it should be calculated. And it has a lot of details that can help you down the road if you need more details behind each of the CQMs that you're attesting to. Okay, so the Cert edition, and this is extremely important in 2019. The provider's 2015 edition Cert must be used to calculate eCQMs for Program Year 2019. And this is slightly different from Program Year 2018, where you did not necessarily have to have 2015 edition Cert implemented in your system or on your computers. However, for Program Year 2019, you do have to have 2015 edition Cert. Certs may not be certified to calculate all 50 eCQMs, so providers should check to see which eCQMs their Cert is capable of calculating and select those that are relevant to their practice. If there is not a relevant eCQM that the Cert is certified to capture, EPs should report on what their Cert is capable of calculating. And this is why CMS came out with the guidance regarding the outcome measures, and if there's not one relevant to your practice, you can choose a high priority measure. So as you're looking, you need to look at what your Cert is capable of reporting to make sure you're attesting to the correct 6 CQMs. So some of the documentation that is required and you want to make sure you have when you're attesting to the program. You need to run an eCQM report from the Cert for the appropriate reporting period. So keep in mind that 90 days versus 365 days. You need to prove the eCQM data was calculated by the 2015 edition Cert, so that the report must show the Cert name. When you print that report from your Cert, make sure that PDF or however you pulled it from the Cert is showing the Cert name in the edition, that is 2015 edition Cert. Or you can provide screenshots demonstrating how the report was pulled from the Cert. So you can screenshot the steps that you took inside of your Cert system to pull the PDF report. The report should include the following: the required number and type of eCQM. So make sure you have 6 CQMs on that report at least. If you want to include all the CQMs from your Cert into the report that you upload to EPIP, that's totally fine. It's a safety net right there for you, just in case down the road something happens and maybe one of the CQMs is not relevant to your practice and you didn't realize that during attestation. The report needs to show the numerator and the denominator for each eCQM. So if a CQM has 2 parts, make sure the 2 numerators and the 2 denominators are showing. However that CQM works, make sure your report is calculating and showing it. The report needs to show the most recent eCQM version of the Cert that was available, or that the Cert has available. The proper reporting period. Again, you need to make sure the reporting period will be 90 days for EPs attesting to their first year of MU, and then the reporting period will be 365 days for returning MU EPs. So just make sure you're using the correct reporting period. So we're going to go over a few audit findings. What happens during an audit? So if you're selected for an audit, all providers that receive a Medicaid PI incentive payment could potentially be selected by Access for post-payment audit. So you should prepare all that documentation ahead of time just to be safe, to make sure you have it when you're attesting, just in case you're selected for audit. If you are selected, Access Post-Payment Analyst will conduct a thorough review of the documentation attached to your attestation and EPIP to determine if it meets the program requirements. Access may have follow-up questions or make additional documentation requests. So just some common audit findings when it comes to CQMs. The eCQM report does not show it was pulled from the practice's Cert. Make sure your report shows it was pulled from the Cert in the addition software, or screenshot the steps that you took to pull that report from the Cert. Failure to maintain documentation in practice no longer has access to the Cert. So if it's a year down the road and y'all change Certs, or something happened to the Cert, you may not be able to access it. So make sure you maintain that documentation and keep control of it, because we have seen where people have failed to maintain proper documentation. Another common finding is reporting eCQMs for wrong reporting period. For example, an EP uses a 90-day period when the 365-day period should have been used. Then you're going to have to go in and pull a 365-day report. So just go ahead and make sure you have the correct reporting period. Including data for the entire practice in the reported eCQMs rather than data for the individual EP. So the eCQM report needs to be per provider. So if you're testing for 5 providers at your practice, you need to have 5 eCQM reports uploaded for them during attestation, and it needs to be for each individual provider. The eCQM, the numerator and the denominator for the CQM should only relate to who the provider saw that you're attesting for. And another issue is not uploading the eCQM report when attesting for a payment. If you go ahead and upload it now, that's not going to be an issue for you, but make sure you have all the correct details and the data that's on that report that needs to be there. So some of these resources, so I'm going to click on each of these links, and when you receive this webinar in 3 to 5, it should be uploaded to Access website and Health Current website in 3 to 5 business days. And so you can click on all these links. So I'm going to walk you through how to use each of these websites and how they're important and relate to you. So the first one is the Eligible Professional eCQI report. And so this is going to take you straight to the eCQI Resource Center. And sometimes if you go to the home page, you may have to come up here to eCQM and click on Eligible Professionals. However, the link in the webinar takes you straight to the EPs. And if you scroll down, it does have some overview information on the website. If we go down, it's going to show the performance for the reporting period. So right now we're focusing on 2019. However, if you want to go ahead, you can click on that, and you can use any of these program years. And once you select a program year, you're going to have to click the Apply button. However, it's automatically set for 2019 because the majority of providers are working on their program year 2019. So under this, in this table, there's a bunch of different links that can help you with attesting and just seeing more details behind the CQMs. One of the most important ones is the 4th one down, Eligible Clinicians and Eligible Professionals table of eCQM. And so you can pull up the PDF version. I'm going to just open it in a new tab. And so this is a PDF that, once you go to the second page, it lists all of the CQMs that are available for program year 2019. It lists the ID, it lists the measure title, the description, the numerator, the denominator, even the quality domain. So there's a lot of useful information in here if you need it. Another thing that's important, so earlier in the webinar we showed you the measure specification. You can continue to scroll down this main page and it lists all the CQMs. If you click on, so say, let's go look at CMS 117, Childhood Immunization Status. If you click on this link to the left, it takes you to the measure specification, and it has all those details that I was showing you earlier. Another really easy way to do this is if you want to switch around to different CQMs. Here on the left, there's a long list of all the CQMs. So if you want to look at CQM 143, you can go ahead and click on this, and it'll take you to the measure specifications for it. And so this is a very helpful tool when just trying to figure out what CQMs to attest to and how it is relevant to your practice. Another relevant link is a CMS eCQM tip sheet, which CMS has put together with just a list of just overview of the CMS program and just reviewing everything. And so it has a list of, in program year 2019, CQM reporting requirements, CPs for the first time. It talks about the reporting period. CPs returning. It also talks about the reporting period. And this was put together by CMS. It has some notes and just additional details to help you understand CQMs better. So then we have links to the federal final rule, and then also the physician fee schedule for program year 2019 and program year 2020, just for your help. So here's the final rule. So it's a quick link to help you if you want to go and look at the final rule. Be aware that there's the Medicaid and Medicare programs in here, so when you are reading it, just make sure you're looking at the correct. It's for promoting interoperability for Medicaid. So then there's also the adult core eCQMs, which we showed you earlier, and the child core eCQMs. But just clicking on those links, it takes you straight to the website, and it shows you the list of all those CQMs that are available that CMS does recommend providers use to attest because it has shown to give better health care to patients. The other link is the outcome measures and high priority measures, which we also looked at earlier, and this is the list of all of program year 2019 CQMs. And so as you're going through that, it shows you which ones have, I have to bring that back up. Looks like my internet, there's too many links and does not like all the different links I'm using. But as showed to you earlier, this contains all of the CQMs for program year 2019, and under measure type column, it does show whether it's an outcome measure, and then under high priority, it does show whether it's high priority or it's also in addition an adult care CQM or a child care CQM. Also, the last link is the Access eCQM frequently asked questions, which we may cover if we have additional time at the end of this webinar. This link takes you to the Access website where we're going to add this PowerPoint presentation and the frequently asked questions document. It will not be made available to you until about 3 to 5 business days, so I would advise you to check in next Friday on the website when you click on the link, and you should see the frequently asked questions. However, if you do need that document sooner than later, please feel free to put your email in the comments section, and we'll get that to you as soon as it's finalized. And here's the Access website where the documents will be added. As you can see in the presentation, there is a caveat, and it explains how to find the frequently asked questions document. But I'm going to show you on the website where it's going to be once it's uploaded. So you click on that link, and then you'll go under Educational Resources, and you'll click this drop-down button. And there's already other webinars and everything attached here to help y'all, but it'll be under one of these sections. The FAQ will be underneath the tip sheets, but there's also going to be the webinars, which is where this presentation will be uploaded. So again, those are the resources that we thought were the most important as you're attesting to CQMs. So if you do have additional questions, you can look at those resources or even continue to put questions into the comments section of this webinar. And so at this point, if you'll have any questions, please feel free to put that in the comments section. I'm going to hand this back over to Connie.
Thank you so much, Priscilla. This is Christine. The chat box is open for those attending the webinar. Please feel free to input your questions, and we'll go ahead and pose them to Priscilla. So far, I have not seen any chat questions come through. But again, just a reminder to those folks that are participating that we will send a copy of today's webinar slide deck along with any of the Q&As addressed during the call to those recipients. The call has been recorded and will be posted along with the Q&As to the Health Current website as well as the Access website in the coming days. Just a reminder, the chat box is open and available if there are questions from those who are participating on today's webinar, and we'll pause for a few moments while folks are typing.
This is Connie. I'm not sure if the Access folks have had some questions that they would like to reiterate now, or Priscilla. Also, if you have some questions from folks in the past that you think would be important to cover here, please feel free to do so.
Yes, Connie, thank you. I'll actually start going over the frequently asked questions as we're waiting on questions to come in. And feel free, Connie, to interrupt me if a question does come in, and just let me know that question's there, and we'll pause on the FAQ document to answer any questions that providers do have, because we want to answer those.
Will do.
Okay. So I will pull up. So this is a PDF document that will be sent out, will be uploaded to the Access and Health Current website. And so we're just going to go through these questions. And if any of these questions jog another question, please feel free to put them in the chat box, and we'll get those answered for y'all today on the call. So the first question is, what is electronic clinical quality measure? So the eCQM uses data electronically extracted from Certified Electronic Health Records Technology, the Cert, and or health information technology systems to measure the quality of health care provided. The Centers for Medicare and Medicaid Services, CMS, use eCQMs in a variety of quality reporting and value-based purchasing programs. So a lot of providers already use this depending on which programs they are attesting to and a part of. The second question is, what is the difference between a CQM and an eCQM? A CQM can be calculated outside of the Cert via a chart abstraction, whereas eCQMs are calculated electronically by the Cert. The phrase eCQM does not indicate the data was transmitted electronically. An eCQM can be calculated electronically by Cert and still transmitted to the agency manually via attestation in ePIP. So that provider is pulling the report out of the Cert manually, but the Cert's already calculated those numbers for the eCQM, and then that report is manually uploaded to ePIP through attestation. All CQMs reported for the purposes of the PI program must be calculated by the Cert. Although the terms eCQM and CQM are used interchangeably for the PI program, only CQMs generated by the Cert are accepted as sufficient for the program. So just make sure those CQMs are being generated by the Cert. Where can you find the eCQMs that you report for each program year? You go to the eCQI Resource Center, which is that page we took y'all to earlier in the webinar under the Resource tab page. And under question 3, it kind of lists out the steps for where you go to pull up that PDF that lists all the CQMs and just where everything is. So this kind of just writes it out for you. So later down the road, if you want to check these CQMs, feel free to come in here and use this FAQ to find where to go on the website to find the list. So even though we showed you, it's written down to help you out. Question 4 is, how many eCQMs must the EP report on for program year 2019? An EP must attest to 6 out of 50 available eCQMs. And you can see this superscript A, and that's going to take you to the link 2019 eCQMs, which I'll bring it up. It's that same PDF that we were showing you earlier. Looks like my computer is wanting to highlight everything. But when you click on that link, should work for you, and you should be able to, it takes you straight to that PDF that we showed you earlier. So we recommend, under question 4, we recommend that the EP run a complete eCQM report from his or her Cert in case of vendor or other issues. ePIP will only allow the EP to attest to exactly 6 eCQMs. However, the Cert eCQM report contains more than 6 eCQMs. So the 5th question is, what is an outcome measure? An outcome measure is a high-level clinical measure used to measure a change in the health of patients. Some of the outcome measures for 2019 focus on diabetes, cataracts, high blood pressure, and dental decay in children. An outcome measure is different from a process measure, which measures a specific healthcare process, such as screenings and monitoring of patients. For program year 2019, there are 6 outcome eCQMs. And it looks like my computer is not liking me at the moment. Let me exit out of this PDF.
Hi, Priscilla. This is Christine again. I just wanted to remind everybody the chat box is still open. We have not received any questions at this time, but I will still leave that open for your FAQs if you would like to continue with them.
please bear with us as I'm having some IT issues. I'm going to open up the Word document that I have, so that way it shouldn't be any issues as we're going through this. Okay, and I'll zoom in to make sure everyone can see this better on your screen. So we were on we just finished question 5 for the outcome measures. And just so you know that when you receive the PDF, you will be able to click on these links, and it'll take you straight to where the list of CQMs are. So for question 6, what if no outcome measures are relevant to the eligible professional? An EP must attest to at least one outcome measure unless no outcome measures are relevant to the EP. In this case, the EP must report on at least one high priority measure. So if you're looking at your CQMs that the Cert has available and the outcome measures that are available, maybe all 6 are available to you to report on. If they're not relevant to your scope of practice, you can move to looking at the 27 high priority measures to see if they're relevant to your scope of practice. And so the question is, what is a high priority measure, which is question 7. CMS has flagged certain eCQMs as high priority. These measures focus on specific health conditions that represent national public health priorities. Question 8 is, what if no high priority measures are relevant to the EP? So if no high priority measures are relevant to the EP scope of practice, the EP may report on any 6 relevant measures. And so that leads to the next question. What does relevant to my scope of practice mean when reporting eCQM? The EP should report on measures that best reflect the types of services the EP provides and the EP's patient population. For example, if the EP is a pediatrician, he or she may select the childhood immunization status, which is CQM 117 version 7 for 2019, as a relevant eCQM. Use of high-risk medications in the elderly, which is CQM 156, would not be a relevant eCQM for a pediatrician. Ultimately, it is up to the EP to determine which eCQMs are most relevant to the EP scope of practice. So try to make sure that you're using those ones that are relevant. So for a pediatrician, they don't see elderly patients. So that CQM of high-risk medications in the elderly would not be relevant to the practice. However, the practice does, or the EP does get to determine what CQMs are relevant to their scope of practice. Question 10. What if the EP Cert is not certified to capture the most relevant eCQMs? For a provider's EHR technology to be certified, the Office of the National Coordinator, ONC, which is the agency who certifies that an EHR solution meets the PI incentive program requirements, so the ONC requires the EHR technology solution to support a provider that is reporting its eCQMs for MU purposes. However, ONC allows vendors to certify selectively which eCQMs their software will support. This means it is very important for a provider to understand which eCQMs a Cert will support. Depending on the population a provider serves, the provider may find that some Certs may not support the reporting of the eCQMs applicable to that practice. If there is not a relevant eCQM that the Cert is certified to capture, the EP is able to report on what the Cert is capable of calculating. So whatever Cert you're using, just make sure to look at for attestation to the best of your knowledge. Try to make sure that you select the relevant ones, and if there's not relevant CQMs to you that are relevant to your scope of practice, then you can report on the ones that the Cert does have that allows you to report on. So question 11, does the state of Arizona have any additional high priority eCQMs? The CMS did allow individual states to select any additional high priority CQMs outside of the 27 that CMS have already selected. So the answer is Arizona has not selected any additional high priority eCQMs. An EP should only use the list of 27 eCQMs that CMS identified as high priority when attesting in the state of Arizona. So the next question is 12. When can EP attest to a 90-day eCQM reporting period? If an EP is attesting to MU for the first time, the EP may attest to a 90-day eCQM reporting period. An EP who demonstrated MU in a previous program year must attest to a 365-day eCQM reporting period. Question 13. Does the eCQM report have to come from the Cert? Yes. Numerator and denominator information for eCQMs must be reported directly from the Cert. So make sure that the CQM Cert report that you upload during attestation to EPIP includes a numerator and a denominator. How do you run an eCQM report from the Cert? If an EP does not know how to pull the eCQM report directly from the Cert, the EP should contact the Cert vendor and request guidance. There's different procedures for each Cert and how to pull those CQM reports, so reach out to your vendor and ask them to help you with that. Question 15, how should a provider upgrades from a 2014 edition Cert to 2015 edition Cert or changes Cert vendors report a full year of eCQMs in 2019? An EP does not need to have 2015 edition Cert by the beginning of the calendar year 2019 or the eCQM reporting period. And keep in mind that some EPs do attest to a 365-day period, so this does apply to them as well. The data that Medicaid EPs are required to report for eCQMs is a snapshot based on the data within the Cert, taken between the end of the PI reporting period and the date of attestation. So you're going to take that report out of the Cert between the end of the PI reporting period and the date of attestation for that reporting period, whether it's 365 days or 90 days. So 1, EPs that have a 2014 edition Cert during the eCQM reporting period and upgrade to the 2015 edition of the same Cert prior to attestation, the data supporting eCQMs is entered into the EP Cert during the regular course of business and will be stored in the Cert. So as you're having patients come in during that CQM reporting period, you're manually, right then during their visit or soon after, entering in that information to the Cert. The Cert should retain data entered in the 2014 edition within the upgraded 2015 edition. So as you're switching from 2014 edition to 2015 edition, that data should translate. The EP should generate an eCQM report between the end of the PI reporting period and the date of attestation, and this report will calculate the eCQMs based on the data entered during that PI reporting period. EPs, so for number 2, EPs that change vendors or practices during the reporting period. The EP must provide 2 reports, one from each system or location, to show the reported eCQMs from both Certs or both locations during attestation EPIP. The EP must add the numbers from both reports together when attesting in EPIP. So whether you're changing vendors or the provider works at multiple locations, you need to get both of the reports. So for example, 2 different vendors and you changed them during the period, then you need to make sure you go into both of your Certs and pull the reporting period for that entire 90 days or 365 days, and then add those numerator and denominator together when you're attesting. And then you should upload both reports to EPIP. So question 16. The eCQM specifications are updated each year. Which year specifications/versions will Arizona accept from providers? Vendors are not required to update Cert each year to the latest eCQM specifications in order to retain their 2015 edition certification. Therefore, it is possible that Medicaid providers will have Certs that produce eCQM specified to a variety of years. Arizona will accept the most recent version for each eCQM. Arizona will allow providers to report an older version if that is all the EP's 2015 edition Cert is able to produce. So for example, there is a CQM that is version 7 for 2019. However, in 2020, the version switched to version 8. The provider say they did a 365-day eCQM period for 2019. The beginning of 2020, they updated their Cert, and the version changed to version 8. But in 2019, it was required that it was version 7. Version 8 is still acceptable when you pull that eCQM report. That eCQM report just has to be pulled from the Cert, from a 2015 edition Cert. So just make sure you're following all the other requirements. It's okay if the version changes if that's the most updated one. Okay? For question 17, for the Medicaid Promoting Interoperability Program, can I report an eCQM with a 0 result in the numerator and or the denominator? A 0 result in the numerator and or denominator may indicate the eCQM is not relevant to the EP scope of practice. While we strongly encourage providers to report relevant eCQMs, 0 is an acceptable result provided that this value was produced by a Cert. So if EPs determine that they need to report on the CQMs that have a 0, they are allowed to do that. However, CMS in Arizona just want to remind the providers that it is probably better and that they encourage providers to report the CQMs that do have the numbers in them in the numerator and denominator, because most likely those are the ones that are relevant. However, the EP does get to determine which CQMs are relevant to their scope of practice. Question 18. Why does CMS recommend EPs report from the adult and child core eCQM sets? Core measures are national standards of care and treatment processes for common conditions. These processes are proven to reduce complications and lead to better patient outcomes. CMS selected the recommended core set of eCQMs for EPs based on analysis of several factors. The conditions that contribute to the morbidity and mortality of the most Medicare and Medicaid beneficiaries, that represent national public health priorities, that are common to health disparities, that disproportionately drive healthcare costs and improve with better quality measurement. Measures that would enable CMS, states, and the provider community to measure quality of care in new dimensions with a stronger focus on parsimonious measurement, and also measures that include patient and or caregiver engagement. So there are reasons for why we're recommending that you use that adult and child core eCQM sets when attesting. So look at those CQMs first and try to see if they're relevant to your scope of practice. Question 19. Can I submit my eCQM in electronic format directly to the state? Arizona is not currently able to accept electronic submissions of eCQMs. The Ecqm report will need to be uploaded to EPIP during attestation. Okay, question 20. What is the difference between program years 2018 and 2019 for eCQMs? EPs were required to attest to eCQMs in program year 2018. The required number of 6 eCQMs remain the same for program year 2019, but the versions have been updated for 2019. However, starting in 2019, EPs are required to attest to at least one outcome measure relevant to the EP scope of practice. Please see frequently asked questions above 5 through 9 for more information regarding this requirement as we discussed throughout the webinar. If the outcome measures are not relevant to your scope of practice, then you look at the high priority measures and try to attest to one of those. If the high priority measures are not relevant to your scope of practice, then you pick the CQMs that are relevant to your scope of practice. So please see the presentation and questions 5 through 9 for the details regarding that. The eCQMs listed below were added for program year 2019. So there's 2 of them, CQM 249, which is the appropriate use of DXA scans in women under 65 years who do not meet the risk factor profile for osteoporotic fractures. And then the second CQM is CQM 349, which is HIV screening. So there are now 2 additional CQMs that you can select from when attesting for program year 2019. As you can see, the eCQMs listed below were removed for program year 2019, which there are 6 CQMs that were removed from program year 2018, moving into program year 2019. So please be aware that you are not able to attest to these 6 eCQMs for program year 2019. And those are the diabetes, the ischemic vascular disease one, the diabetic one, bipolar disorder, pregnant women that had HbSAg testing, and hypertension. So just look at those CQM numbers and make sure that during attestation you're not trying to test to those. And the last question for these frequently asked questions document is, what should an EP do if during the EPIP attestation process the eCQM section does not allow the EP to report on the eCQM most relevant to your practice? Access does not anticipate this occurring, but if it does, please email EHR incentive payments at azaccess.gov and alert them of this issue. And again, as you can see in the FAQ that's going to be uploaded to the website, you will be able to click on that link and it'll immediately bring up an email. And then you can type in the body of the message if you have those questions or any issues during attestation. So you're able to alert them of the issue, and then the EP should continue to attest to the best of his or her ability, write a letter of explanation, upload to EPIP if possible. For any issues, even if it does not relate to eCQMs, you can email that email address and state any issues that may be occurring during attestation, but Access does not anticipate that occurring. At this time, that's all the questions that we came up with ahead of time. If you do have any questions, please put them in the comments box, and we can answer those for you.
Thank you again, Priscilla. This is Christine at Health Current. You've done such a great job. I think you've answered almost everybody's questions, because I haven't had any additional questions or any questions come through the chat box at this time. Just to remember, at the conclusion of today's webinar, we will post this in the next several days on the Health Current website as well as the Access website. The webinar slide deck will also be made available along with the FAQs that Priscilla just reviewed. And again, thank you for presenting today and for everyone that is participating. With that, we are about 10 minutes to the 1 o'clock hour, so if there are no additional questions, which I'm not seeing anything in the chat box, we'll give everybody 10 minutes back to their day. Any other closing thoughts, Connie? Or
No, also wanted to reinforce that I thought you did a great job on the webinar, and we will look forward to doing more with you also. Priscilla, thank you.
Thank you so much, Connie.
Thank you again, Priscilla. At this time, we will go ahead and conclude today's webinar. And again, appreciate everybody's time and attendance. Thank you.
Have a great day.
Thanks.